Great. Welcome to the Hartford Change Agent Action Awards Technical Assistance webinar. My name is John Bielenson, and I'm the president of SCP and a grantee of the John A. Hartford Foundation and part of the leadership team that is responsible for the Change Agents Initiative. Today we have, hopefully a helpful agenda that's going to get folks better prepared to apply to the Change Agent Action Awards. And our agenda is really to kind of talk a little bit about the initiative, talk about what we mean by practice change, particularly how it relates to the grant and how it relates to the grant. We'll describe some of the details of the action grant, and then most of the session or most of the hour will be spent focused on your questions. Today we have a couple of speakers on the panel. The first is one of the co-leaders of the Change Agents Initiative, who is Laura Gitlin, who is the director of the Center for Innovative Care in Aging at the Johns Hopkins School of Nursing, and a change agent in her own right, responsible for Skills to Care and Beat the Blues and a variety of innovations that have improved the health and well-being of older adults. And Laura will be providing us a lot of the overview information about practice change and the initiative. Joining Laura will be Julia Mishi, who is the Director of Operations for the Hartford Change Agent Initiative. She basically runs the show, if you will, and she'll be providing additional details about the grants and about the grant processes. She hails from the Gerontological Society in Washington, D.C. So that's who we have today. And again, I guess the first thing we're going to do is I'll turn it back to Laura, who's going to tell us a little bit about the Hartford Change Agents Initiative.
Great. Good afternoon, everybody, and welcome. We're very excited to have you on this call, and as John indicated, we wanted to start just by being pretty brief here in terms of giving you some of what we consider to be the essential background information that you need to understand our thinking and the purpose of the Action Awards. And then we really want to hear from you what your ideas are, how you're thinking about this. So we hope to have a lot of questions and dialogue. So to begin, I wanted to briefly share with you a broad definition that is our working definition about what is practice change. And of course, this is a broad term, and it's defined and used variably. And we have embraced a rather broad definition of it. And we think this is inclusive of all the different kinds of practice change of the Hartford community and the things that you may be involved in and thinking about. And just to highlight some of the important elements of our definition of practice change, which you see on this slide, is that we see it as a complex, collaborative, and generally transdisciplinary process that draws upon the best available evidence to improve health care and health, and obviously our focus is on older adults and their families. So what's important about this definition vis-a-vis the Action Awards is that we do see these Action Awards as one of expression of collaboration and a interprofessional team that's trying to move forward a particular idea. Also essential to our definition is that practice change does engage at its best older adults and families themselves or other key stakeholders in the design and implementation of what's being changed in practice, whether that be developing and or implementing a new intervention or changing a program or services and so forth. And again, in terms of the Action Awards, the involvement of stakeholders is very important, and the definition of who those stakeholders are should be clearly articulated in the award. The other aspect of our definition is that we embrace practice change in any setting, and we know that the needs of older adults and their families are complex and transcend any one particular setting, so that practice change needs to occur across the continuum from the clinic to the hospital to any long-term care environment. And so we're open to awards, to action grants that encompass any one particular setting. When you think about developing the project for the Action Award, we really are looking for it to encompass what we have identified as key essential attributes of any kind of practice change. And I'm going to be a little bit redundant here, but these represent the attributes that we think is critical for practice change to be successful in whatever setting it occurs. So again, it should have interprofessional collaboration, involve a team of some sort. It would involve possibly coordinating organizational partnerships in a particular setting or within a community organization. The practice change should be informed by evidence. It should reflect best practice. I think the two go hand in hand. It should in some way advance a person and or family-centered care approach, and it should promote equity and access and address an unmet need that perhaps can close various kinds of gaps in of older adults. We've also identified what we're calling 6 domains of practice change. These just represent broad areas in which different kinds of practice change activities can occur. And Julia will review with you in a moment how one of the requirements for the grant application is to indicate the primary domain that you are working in. You may find that you're actually working in multiple domains and they do overlap, but we want you to identify the one that best reflects the kind of project that you're proposing. So very quickly on this slide, you see that one domain is transforming practice, care, and services by changing a particular clinical approach or adopting a new model or integrating a particular model in a particular care setting. Another may be redesigning a system of care that would go across organizations or networks. Another type of practice change involves advancing public policy by conducting some kind of advocacy or seeking some kind of regulatory or reimbursement change. On the next slide, we have the 3 other domains of practice, which would involve connecting health profession, education, integrating perhaps evidence within different kinds of educational or training domains. Another area is crafting quality measures and tools, and yet another would be to actually develop a model program by creating and testing new care models. So any of these areas of domain or practice change are certainly reasonable to develop an action award in. One may be more relevant, as I said, than another to what you are specifically doing, and that's what you would want to highlight. So with that, I'm going to turn it over now to Julia, who will get into the details of your actual application.
Great. Thank you, Laura. So I'll just be briefly going over some of the things that are already covered in the request for applications, just to highlight a few things that we want to make sure that you know about when you're preparing and submitting your application. So the first thing I'll just cover is that the first page of the application itself describes in more detail, but we really see the purpose of these action awards as being awards that are to the point of achieving meaningful change to practice or policy, and meaningful that improves the health and well-being of older adults and or their families. And we're looking towards these proposals to foster collaborative and interprofessional efforts to change practice and using best evidence or best practices, as Laura has just covered. So in terms of the requirements, these are intended to be small grants, and you can request up to $10,000. These are one-year awards, and we expect to fund 5 to 8 awards under this particular cycle. As Laura highlighted, we do expect that there will be involvement of an interprofessional team, and that you will think about the adopter organizations and stakeholder organizations that need to be involved or would be obvious involved in your particular proposal. The lead applicant must be able to identify their affiliation, either past or present, with one of the John A. Hartford Foundation programs. And we do have a list on the Change Agents website at www.changeagents365.org. So if you need a list to refer to, there is a list there that you can look at, or also just describe your connection to that for the lead applicant. We also request that along with your application, you submit 2 or 3 letters of support which address the commitment of key organizations or individuals related to your practice change that you're proposing. And the number really depends on how many stakeholders are going to be engaged in your project. That's something that you'll have a better idea of. So 2 or 3 is what we are suggesting. In terms of the application components, those again are described fairly well there in the request for applications. But I will note that the cover sheet itself, that's where we would like for you to indicate which type of practice change, the 6 areas that Laura just spelled out. We are making you choose which one you think best fits your proposal. That also includes a 300-word abstract or summary. And we want to make sure that you also provide just some basic information about the letters of support on that cover sheet. Then you'll have the proposal narrative, which can be up to 8 pages, and we're asking that those be double-spaced, and you can see some other requirements there related to that narrative section. And then I just want to highlight really quickly that there are several pieces that we're looking for in the narrative, and that you read through and address significant questions there that are provided in the application, the goals, readiness. We are looking for a proposed implementation plan and some thoughts in terms of how you will kind of assess your own accomplishments in relation to the project. Think through a little bit of potential for sustainability and next. Certainly we understand these are small awards, but your thoughts on deliverables and dissemination, those are things we are interested in hearing you talk about, but also are as an initiative, interested in helping you on and talking to you about those. And then, as you can, address any possible barriers, as well as facilitators for this particular project. I've already covered letters of support, but I also want to note there is a budget template that's in an Excel document that's on the homepage of our website that we ask that you use. In addition to that, we do want you to submit a narrative that would cover any items mentioned in that budget spreadsheet.
Julia, this is John. Let me just jump in for a second. It sounds like somebody may either be on a cell phone or, again, hasn't yet muted their phone. Because we're recording this, it would be great if everybody could mute their phone so we can hear Julia uninterrupted. Thank you very much.
Okay, thanks, John. I appreciate that. And we appreciate your help with that as well, as I know there were people who probably want to listen in on the recording. I'll talk just very briefly about submitting the application itself, and there's certainly more detailed information in the application which is available on changeagents365.org. But I want to remind you that the deadline for submitting the Action Awards proposal is 5 o'clock, and that's Eastern Daylight Time, Tuesday, June 10th. A couple of things that we want to make sure that you do is to include all of the pieces of this particular proposal. So that includes the cover sheet, the letters of support, budget, and I would say budget narrative. Should all be submitted by email, and it should be submitted with one single PDF document. So we're asking that you take all of the components of this application and pull them into one single PDF that can then be sent by email. The other piece that's mentioned in the RFA is that we would like for you to use in your subject line of the email Change Agents Action Awards application, and that'll just make sure that this kind of goes into the right delivery. The last thing I'll cover is just related to timeline. So we discussed the due date. We will be getting back to people who have applied by July 15th. And then the start date of these awards will be August 1st of this year. We do believe that we will be pulling all of the awardees together probably throughout the year for calls just to kind of allow the different people working on these projects to share information, to collaborate and provide, shared lessons learned. But we do know at the halfway mark, at 6 months, so that would be January, that we'll want to definitely be bringing everyone together in a more formal way to kind of see how things are going and provide technical assistance if needed at that time. The end date then for these awards will be July 31st, 2015. And we will be asking for a final report, which would cover the entire project and would include a narrative as well as the final financial report. And so hopefully that's covered many of the basic questions that you may have, but we would love to hear from you now if there are other things that you would like to know or that would be helpful to you, particularly in thinking through creating your proposal and submitting. So John, I'll turn it back over to you.
Thanks, Julia. We've had a number of questions. The first set of questions that have come through chat are whether the slides will be available for download. Yes. In fact, the slides will be available for download, as will the recording of the conversation. So yes, this should be available, and you can refer back to it at any time as you develop your proposal. If folks would want to raise their hand or want to send us a chat for any other questions. We have a question on a chat from Janice Guzman. What can and cannot be funded? So, for example, FTEs.
Oh, that's a great question. We do have, so again, this is a small award, and so we recognize that this is $10,000 or less. We have a main project lead, and we have a second project lead, and we anticipate that in order to make these small awards happen, that there will be some personnel time, and that's indicated on the budget spreadsheet. We've not placed any limitations on that. We believe you all kind of know what it will take to complete your project, but the only thing that we will say is that we do not allow any overhead or indirect costs.
Great.
Yeah, the other thing I guess that I would make sure to point out to folks is that we will look to make sure that what you've expressed in your narrative makes sense in terms of your budget, and so we wouldn't want to see a budget that would have a lot of equipment heavy if it, particularly if it didn't really make sense in the context of that proposal.
Great. We have 3 questions from Ina Lee, Joseph Hunter, Barbara King, and Deanna Gray Miceli, and we'll get to each of those. I just want to highlight that, forecast that we'll be getting to you in that order as they come in. So Ina Lee's question is, will there be another request for proposal later this year?
That is a great question, and yes, we are intending on having these awards requests for this type of award twice a year, once in the spring, so this would be the spring cycle, and once in the fall. And we anticipate that there will be this fall an announcement, probably that coming in August is when you would hear about when the deadline for that would be.
Great, thank you. Amy Asselray, we have a question for you that'll come in next in the queue. But Joseph Hunter asks, is there a number of disciplines that should be or best to be included?
Hi, it's Laura, and I would say the answer to that is no. Whatever disciplines make sense for the purpose of the practice change that's being proposed is important. We think that the best practice change typically involves more than one profession and possibly the involvement of different kinds of stakeholders, including. So I think that's the backdrop for you to think through, who should be involved with your project.
John, do you want to take the next question?
I'm sorry, yes. We still have some ambient noise. Please make sure that your phone is muted. Thank you. We hear people typing, et cetera, which is not that helpful. So we have a question from Barbara King. I'm interested in submitting a grant to fund an intervention that will contribute to a larger systems-based model of care. Would this be appropriate for the award?
So that's a great question, and I think a lot of the times the types of questions we're getting when they relate specifically to a project are probably better ones that we should talk one-on-one about. I don't know if Laura feels differently about that, but I'd certainly be willing to Barb, reach out to you afterwards or have a conversation with you on the phone, and we can definitely think that through together.
Yeah, and I agree with what Julia just said, and we can help possibly shape the concept. But I do think it's important to realize that this isn't a traditional research initiative where you're developing, if you think of a pipeline for developing an intervention. But if there's an element of the intervention that needs to be embedded in a practice setting, and these monies are going to help do that, which would have the ultimate goal of changing the way an organization provides care, then this award approach, this action award initiative would be appropriate. But we can, as Julia said, kind of brainstorm with you offline perhaps in terms of how to shape your ideas for this particular action award. And I think also in terms of the 6 domains of practice, it would be, I would see just reading your comment that you'd probably fall within transforming practice, care, and services or developing model programs. Turn it back.
Great, thanks. We have a question from Deanna Gray Maselli. Do you require a DUNS number and other specific detail if you collaborate with a hospital or facility, such as identifying facility information?
So this is Julia, and I don't believe that we would require a DUNS number. One of the things that we will do with people who receive the award is communicate with them on the details of where the funding, or rather where the check will be going, and there will be an agreement that we will have the individual who's receiving the awards sign, but that generally does not include the DUNS number, although I think you're probably on the right track if you're thinking in terms of identifying facility, in the proposal itself. But the money, we think, will probably be going to the project leaders organization.
Great, thanks. We have a quick question from Amy Asselrain. Is the application due 5 p.m. Eastern Standard Time or 5 p.m. in the applicant's time zone?
Great question. It's 5 p.m. Eastern Daylight Time.
Great, thanks. Let's see, another question from Ina Lee. Does the Hartford change agent applicant have to be the lead investigator in the application, or can one of her or his colleagues be the lead in the Hartford program, be more in the periphery? That's a very good question.
Well, in the application itself, we have provided some guidance related to that particular question, and we had suggested that in the context of these awards, I would advise us to think in terms of project lead rather than lead investigator, because they're practice change oriented. And so with that in mind, we've provided guidance that the Project Lead 1 must be the person affiliated past or present with the Hartford Foundation. And then Project Lead 2, we have not provided that specific parameter. I'm not sure if that addresses really the crux of the question there, but in terms of identifying those two people, for the application process, that's the answer.
Great, thanks. Quite another question from Joseph Hunter. Are any organization types, federal government, state government, county, for-profit, nonprofit, excluded from applying?
We are not excluding on the basis of organization in terms of who can apply, although we certainly recognize that there may be some additional parameters around working with particularly VA or other types of government organizations that might, where the where the project lead might be housed, and we'll be willing to work with you on those.
Great, thanks. Another question from Deanna. Can applicants apply for more than one at the same time, provided they are different practice change concepts?
Yeah, I would say no, and that you should just focus on one to give yourself the best shot also. Sometimes also just from a grantsmanship perspective, it's really hard to submit to very competitive ones, but we would want one application from an individual / organization / team.
Great, thanks. Question from Karen Reynolds. Does receiving an award in the spring of the application year make you ineligible to receive an award in the fall or subsequent years?
It's a great question. I don't know that we would fund multiple awards to the same person, project lead or entity or organization, but I'm not quite sure the intent of the question here. We envision that if you aren't successful in this particular application cycle, that you would definitely be able to resubmit.
And I would just add that for those who do receive the award, and also for those who do not, we do envision providing technical assistance to help people advance their action ideas and to secure the kind of funding they may need. So we may, for example, if there's a need and a desire, have a webinar on those kinds of things, what kinds of funding sources are available, or what may be the next step to advance a practice change idea.
Great. So let's see. So that reflects all of the questions that have come in thus far. If folks want to raise their hand or again add any other questions, we certainly welcome them. I wonder if Laura, if there was anything else that you wanted to say in terms of specific examples or other aspects of the Action Awards that you'd like to sort of remind folks about.
Well, I just wanted to say that this is the first time that this kind of an Action Award initiative has been developed. And so I want to just emphasize that we're also here to learn from you in terms of your ideas and what will be needed to take your ideas into practice and really make a difference. So based on the applications for this first initiative, we will regroup and evaluate, and we want to hear from all of you, and we may move forward in initiatives that are more specific. But at this point, I hesitate to give examples as much to say that we really want to hear from you and your creative spirit and get an understanding of how funds such as up to $10,000 can be used to make a meaningful difference in a particular setting.
Thanks. Thanks, Laura. Carol Waters has another question. After the awards have been granted, will these practice change ideas be shared after the year is complete? So is there sort of any reporting requirement, I guess, out to the community, the change agents community and more broadly?
Well, we do envision several things. First of all, and I'll ask Julia for you to talk about the community in a moment, but we do envision that each of the awardees would participate in the community forum of the Hartford Change Agents, which would involve developing an online micro-community, if you will, of people that can focus on the particular activities that are being proposed. And I think that would enable awardees to get feedback from a much larger community and input, as well as have a workspace to advance the kinds of activities that are being proposed. Also, we would, really encourage, and through ongoing conversations with the awardees, we would work together to figure out ways to promote, disseminate, and advance the particular practice change that folks are working on. So we see this as a long-term relationship in which we can learn from each other and really support the awardees. And for those who are not awarded, we hope to be able to provide some ways of helping you think through concrete steps for advancing your particular ideas as well.
That's great. That's great. I was just about to say something else, but Joe Hunter has another question. Can an application for an award be designed to be 2 or more phases such that subsequent phases may further refine and or conduct research on the practice change?
I'm actually not sure how to address that question. I think that we want to see a proposal that is for a set of activities that can be accomplished in 1 year and has some impact. Now, again, we recognize that the funding is small, and that may lead to another phase of activity, and so that would be appropriate. But this particular proposal should not necessarily suggest that there are multiple steps that would need to be taken beyond the 1 year to evince a particular type of change that the person's seeking. So I guess what I'm saying is to think through what can be accomplished and to be clear about that. And we recognize that the change may reflect one particular setting, for example, but that the applicant may have a vision for impacting, an entire healthcare system. So that would be, I would say that that's important to state, but that is the intention, but that the application itself should have something at the end of a year that reflects some change in some way.
Great. Thanks, Laura. Good. So maybe if, as folks perhaps are thinking about any final questions or additional questions, Julia, you might talk a little bit more about some of the other activities that are taking place in the community that are, not actually obviously action awards, but are nevertheless supportive of the kind of practice change that the action awards would indeed support. So perhaps you can talk for a few minutes about that.
Sure, John. I would first of all just want to make sure that anyone who didn't get the answer to their question today knows that they can also email us at changeagents365@geron.org, and we would be happy to get back in touch with you either by phone or by email, depending on the type of question that you have. Hopefully most of you all, because you've heard about our Action Awards, have also had a chance to check out the Change Agents website at changeagents365.org. And there you'll find a variety of information, requests for proposals, as well as information about some of the upcoming activities. One of the things that's happening in June is our Change Agents Policy Institute. That application process actually, I guess, just closed up about a month ago, and we have 21 individuals who will be coming in June, and we'll be announcing that opportunity. It's an annual opportunity, so we'll have more information about that if you're interested in coming next year. And there's a Communications Institute that John runs that also just finished an application process, but will also be an annual institute available to change agents. We also will be having in the fall a Change Agents Conference, which will focus on leadership, specifically as it relates to leading practice change for health of older adults and their families. And so more information about that coming very soon, and it will also be the type of opportunity that we will have individuals applying for. So all of that information would be available on our website. And then the last thing I want to make sure that people on the phone have done is received information about the Change Agents online community. And there is a link to that community from the home page of our website. So if you haven't had a chance to log in, we encourage you to do that. You can actually search a database of over 2,600 change agents. You can search around areas of interest. You can search by Hartford affiliation. There's a lot of good things that you can do on the community, including engage in some discussions in the open forum. So that's just to highlight a couple of things that we are doing. And not sure, John, are we ready to move on?
Well, I think that's, again, I don't know if we have any additional topics to cover, but we don't have any additional questions on the chat. If anybody wants to just simply speak up and ask a question, they can certainly do that, and I'll give us a brief bit of silence for folks to do that. But if not, I think we'll again close the phone call in a minute or so, and again, in fact, we'll be happy to respond to queries, et cetera, at this address, changeagents365@geron.org, if folks have additional questions as the process rolls on. But so I'll just be quiet for just a second and see if anybody is interested in asking a question out loud. All right, so hearing none and seeing none on the chat, on behalf of the Change Agents Initiative and the John A. Hartford Foundation, we want to thank you for joining us this afternoon. Again, the Action Awards, process and opportunity will be rolling out on this schedule. Again, the due date is June 10th, 2014 at 5 p.m. Eastern Daylight Time. So please note that. And if you have any additional questions, please don't hesitate to write us. And again, we want to thank you all for your attention this afternoon and for doing all the important work to improve the care and well-being of older adults and their families. And we look forward to seeing those applications on or before June 10th. Thank you very much.
Thank you, everyone.